Staff at Memorial Behavioral Health in Springfield, Illinois, are on call around the clock to talk with people struggling with suicidal thoughts, drug addiction or other mental health crises. They provide a listening ear and help connect people to resources or crisis support, if needed. Until recently, the hospital's call center was operated by on-call nurses and other clinical staff. But at times when everyone was tied up with patients, calls would go unanswered, bumping the caller to the nearest available call center, often in another state or national backup center. Staff would answer the phone 24/7, but if they were busy with intakes or with residents, then they wouldn't be. Across the state, Illinois-based call centers answered just 1 in 5 in-state calls to the Lifeline in the first 3 months of 2022. The other 80% were redirected to other states. Illinois has the lowest in-state answer rate in the nation, lagging far behind others. The state with the second lowest rate, Texas, answered 40% of its calls during that same time period. Letting so many calls go unanswered wasn't ideal, but without state or federal support, Knaebe said it was the best they could do. The center has since received federal funding to beef up their call center. It's part of the rollout of a new national mental health crisis number, 988, that proponents hope will make it easier for more people to connect with the National Suicide Prevention Lifeline when it is launched on July 16. Knaebe said the new funding enabled Memorial to switch to staff in the crisis line with dedicated employees instead of on-call hospital staff. Even though they've still got several open positions they're trying to fill, she said they've already seen big improvements in their answer rate. In April, where we did that, we were able to answer 80% of the calls versus 20% in previous months, Knaebe said. Following national trends, 3 in 10 adults in Illinois reported feeling anxious and depressed late last year, according to a survey conducted by the U.S. Census Bureau and analyzed by the Kaiser Family Foundation. Among this group, 24% did not receive counseling or therapy. Prior to the pandemic, 17% of adolescents and 8% of adults in Illinois had a major depressive episode in the past year. Nationally this was 16% and 8%, respectively. Preparations for the rollout of 988 are in full swing across the country, yet call centers are scrambling to hire people by mid-July, and some states have a lot of catching up to do. A study by the RAND Corporation released earlier this month interviewed 180 behavioral health program directors and found that half had not been involved in any planning related to 988. A vast majority of respondents reported they had not helped develop a budget to support the Lifeline. In Illinois, underinvestment has plagued call centers for years.